Beacon's been a part of OrthoOklahoma since really our inception back in 2007. Lori and her team were with us from day one. We kind of joke around here. We don't really think of Lori as a vendor, or Jordan or Stephanie or anybody else on their team as an outside vendor that does a service for us. We really think of them as part of the OrthoOklahoma team. When Beacon first started working with us, I think they did have some experience in working with medical organizations, but not so much with an orthopedic group such as ours. And the one thing that was really impressive about the team was their ability to go out and educate themselves and to learn very quickly and intuitively what some of the hot buttons are in orthopedic medicine. We didn't feel like we had to go out and train them as far as the language and the terminology and what some of the issues, both professionally or maybe even politically, might be with regards to the practice of medicine in America today. But they went out and they did the research and they really educated themselves to the point that they were very prepared, and I was very impressed that they had a level of expertise when they came to the table to say, okay, here are the things that we've learned. Here are the things that we feel like could be an issue for you. Obviously, some of those things lined up very closely to what was very important to us at the time, but also, and maybe more importantly, they had gone out and identified some issues and some things that we hadn't even thought about before. And maybe some things that we had thought about, but had a little different spin on it, a little different approach, and what that means to the consumer and what that means to our customer, which is the patient, and really put a light on things that was a very fresh perspective for us. We looked through a lens of, this is our company, we've been through medical training, we feel like this is what we need to know with regards to delivering health care to these folks. But Lori's group and Beacon, they brought a real human element to what that means to a patient, to a customer, to somebody who doesn't currently need our services, but might need to know about us in case they need our services in the future. So that was really, really valuable when they brought that to the table for us, and we really appreciate that. Lori's helped us with everything from front office training, verbal skills coaching, to conflict resolution. She's done some customer service training with our group. She's worked with our front office staff as far as how do you respond to this objection or how do you respond to this situation. Obviously, tons and tons of PR work with regards to how do we make sure that our customers, our patients, the patients that are trusting us with their health, are having the best experience they can, from the way that we answer the telephone to the things that we publish with regards to patient information, whether that's information about the patient's diagnosis or the surgery that they might be having or their physical therapy and MRI that they may have as a part of their OrthoOklahoma experience, to advertising, all the way from as simple as telephone advertising up to radio spots to print advertising. So Lori really is our PR advertising contact. You know, the Beacon team, their strategy, our strategy, they've been with us every step of the way. I've heard Lori speak. She's obviously well versed in all things PR, all things strategy oriented. She's actually spoken at the National Orthopedic Executive Association meeting. Did an outstanding job there. I know that her experience in the healthcare field, which is what we're most interested in, is second to none. In the healthcare industry, which I'm sure is very similar to other industries, there's a mechanism for us to measure our performance through associations, through journals, through benchmarking surveys, through association meetings. So there's a way for us to know how we stack up against others in our industry. And the thing that we see in orthopedics is that most of these better performing practices are in places like Dallas or Chicago or LA, some of the big metro hubs around America. And the thing that we were very impressed with is that rather than having to identify and locate a PR firm or a strategy firm that could bring some of that expertise to us, we didn't have to go to Dallas, we didn't have to go to Chicago, we didn't have to go to one of these big urban centers. We were really happy and impressed that we were able to find something like that with Beacon right here in our own backyard. Obviously, logistically, it's great for us because whenever we have an idea or we have a problem or we have a question or we want to launch a new initiative, they're right here with us. We're not waiting to somebody get on a plane or schedule a conference call in a couple of weeks when they have time. I can email or call somebody on the Beacon team and they can be over the same day or the next day, or they're very flexible and can work that out with our schedule. So just logistically, it's great to have somebody like that here locally. But I think even more than that, and more impressive than that, is that the level of expertise, the quality of the service, the ideas, the strategy, the way that they're able to work with us, it really is a high-level professional organization right here in Central Oklahoma, and that's been great for us. We're glad that we have a relationship with Beacon and work with Lori and her team.